CataractCoach.com. Behind the scenes, inside my operating room, let me show you a real-time setup, timeout, prep, drape, surgery, and turnover. So we're going to put some blur in here to provide some anonymity, so you'll forgive me for that. And I've got my phone here recording and just placed against the wall there. So I'm confirming there's the lens power. That's me. We're confirming that we're using a certain lens power. We make sure we have the right thing. I'm looking at the patient's notes here, confirming everything, the steep axis, what I have to do. So that's my thumbs up. I'm ready. The staff is setting up. Look at the left side of your screen. We have the two scrub techs who are setting everything up. That's the circulating nurse. And again, I have to blur this out for their anonymity. It would take way too long, if you know anything about video, to blur their individual faces as they move throughout the room. It would take a tremendous amount of time. And I don't have a professional video editor helping me. I'm solo here. And so now I've just put a big box across that has a box of blur. But believe me, you'll get the idea. And tomorrow's video is going to be the actual surgery that we're doing here. I'm going to show you the microscope view of the actual case. So then we're getting everything set up. You can see that scrub tech with the red cap is just coming in, already just scrubbed her hands, putting on her sterile gown. You can see on the right of your screen, we have the circulator wiping down the anesthesia connections, the cords, to disinfect them. And now you can see the other scrub tech helping her get buttoned up and gowned up here. That looks great. You see there's the fake machine, there's the microscope. The fake machine and microscope are already placed in the appropriate positions on the floor. So I know where I want this to be for this patient, for this eye. We're going to be doing this patient's right eye. And so now she's gowned up and ready, all sterile. That's the one with the red cap. And now she's going to get things arranged. Open up our trays, our instruments, the draping, everything's going on here. And you can see we're pretty efficient. There's me. I'm just kind of moving my pedals where I want them, making sure I'm happy there. That all looks pretty good. And making sure, asking them if they're good, if they need anything else from me. And we're just hanging out while they set up. So I have a little bit of downtime here. There's no rush. And again, I've already confirmed my lens power. And so we're about 2 minutes in. By about the 4.5 minute mark, you're going to notice that the patient's going to be brought in the room. So that's how fast they're setting this up. So what I'm showing you here is a complete cycle time of about 15 minutes or so. That's quick. But look, we're not rushed at all. I'm hanging out. We're talking. There is zero pressure. We're not rushing at all. This is being efficient, but being very relaxed. No one in the room is pressured. And so that means cycle time means beginning of one case to the beginning of the other is going to be about 15 minutes. So everything's done. Room cleaned, instrument, everything set up, instruments opened, gowned up, patient prepped, which you'll see, and timeout done, and draping done, and surgery done, and clean up everything, get the patient out of the room. All that's just 15 minutes. So you could certainly do, at that pace, 4 of these surgeries per hour in one operating room. We tend to do it a little bit slower. We probably average more like 3 to 3.5 cases per hour in one operating room. And certainly if you're a surgeon who has 2 operating rooms, you can flip-flop back and forth. You could certainly do 6 cataracts in an hour. But again, there's a balance. I want the balance of the best possible outcomes while being efficient. So I'd rather do 6 beautiful cases, let's say in 2 hours, as opposed to 8 okay cases in 2 hours, because the time's not the big issue here. And so we want things done right. And everything you're seeing today here in this setup is the way I'd want it done for my own eyes or my family's eyes. So this is done right. And so you can see she's setting things up. No one's in any big rush. It's done correctly. And we'll do all the proper timeouts, all the proper checklists. Everything's going to be done. So we're about 4 minutes in here. Again, just kind of recording this so you can get an actual view of what happens in my operating room. And by the way, happy 2022. Happy New Year. This is my January 1 video for 2022. And there you go. Machine set up. Look, she's putting the sterile cover there over the machine. And then it's being primed. And she'll get that bag spiked. Now she's covering her Mayo stand. Looking pretty good. And here I come. And look what I'm doing. I'm sitting down because look who's being wheeled in. The patient's being wheeled in. So here comes the patient. Anesthesiologist already given the patient a little bit of sedation, usually about 1 milligram of midazolam in the IV prior to wheeling the patient back. Now, I'm taping the head in position. There's tape over the patient's head. The scrub tech's going to put some sterile tetracaine. She has a bottle of sterile tetracaine on her field, so I hold the lids open. And then she puts a lot of tetracaine there. And I get the patient's head positioned where I want it. We're already ready to roll here. I have the patient's bed at the correct height that I want. I'll bring my microscope in. That's what I'm doing there in the back. And I'm looking at the patient's eye, making sure the focus is where I want it. And the scope has been reset. I'm comfortable. That looks great. And once I'm happy and I examine the cataract again, make sure I know what's going on. I say hello to the patient. I know who the patient is. All right, I push the scope out of the way, and you can see this man with their back towards you and the greenish hat. He's doing a timeout and confirming everything. Everyone in the room is agreeing to the timeout and making sure this is the correct patient, correct eye. Everyone's on board, and we're good to go here. Now, we've already done a previous timeout in the pre-op area before the patient got a little bit of a midazolam. And so now we're confirming again. I'm confirming the lens power again. That's me holding the lens. That's going to be a preloaded single-piece acrylic lens. And that looks good. I leave the room to go get scrubbed up. And you can see now it's time for the prep. So now the circulating nurse is putting on her sterile gloves. And she'll bring over her sterile prep tray. And there's the sterile prep tray. She's opening up all the supplies in a sterile manner. And she'll go counting it out. And again, look, I'm in no rush either. Now I go over there. I'm getting gowned up. And so here's the gown for me. I'm on the left side of the screen. And then now the patient is being prepped. It's a betadine prep. We do a very thorough and complete prep. And I spin my gown. I'm ready to get going here. And you can see machine's already set up. Not only is the machine set up, the tip on the machine is correct. The machine's already in the preferred starting mode for me, which is a chop mode. And I'll change the mode throughout the case with my foot pedal. I don't ask the circulator to do that. And one thing you're going to notice when I operate is I barely have to look outside the scope. Now look what I'm doing there to the left side of your screen. Just to help the scrub tech, I'm setting up the viscoelastics. Let me not be useless. Let me do something. I don't want to stand there. So she's setting up the cohesive and dispersive viscoelastics and the tubes, putting the cannula on. Let me do that. Now in my hands, look, I have my left hand, I got those two orange handles that go on the scope, sterile handles, and my right hand, I have the drape. Now the scrub tech with the red hat is going to bring over the head drape, put that over the patient's head. The prep is done. That'll be thrown away. And I'm standing there sterile. There I am. Here I'm going to put the plastic drape over on the patient's eye. She's going to put the big drape over the patient's body. And then we'll open that up. And next step, she'll bring the mayo over. So now everything's prepped and draped appropriately. All I need to do is cut that drape and then put the speculum in, and we'll get this case started. We'll put the speculum in and then put more tetracaine before we start the case. And so that looks great. And you see, no one's rushed. No one's rushing at all. Taking our time. And then, again, these technicians here are fantastic. Everyone in the room here has done at least a couple thousand cataracts, so they really know what they're doing. And this is why you need to go to someone. If you're a patient watching, this is why you need to go to a surgeon who specializes in just your one surgery. You got a surgeon who specializes in cataract surgery, you're going to get really great treatment because the whole team is on board. Now, here you go. I got the handles on the scope. I'm going to bring the scope in. And remember, tomorrow's video, I'm going to show you, I'm going to overlay on top of this the actual surgical footage. And so you can see the case happening. In this video, you're not going to see the case happening because it's blurred out a little bit at that level. But you see there's a monitor back there, and we'll show you that tomorrow. But for today, I just want to show you the technique. I just used a Wexel to turn on the recording, threw that away, and now I've got the eye here. It's lined up. I'm already making the first incision. So when I make that first incision, I'm going to put some anesthetic inside the eye. Notice how the scrub tech is so good, I don't look away from the oculars. I'm going to operate the whole time, and you're not going to see my head pull back from the oculars. I don't even have to say anything. She's watching the monitor there and seeing the surgery happen in real time, and she knows what to hand me next. So she'll just hand the next instrument. She even knows when to call for the lens. If everything looks great, they'll call for the lens. I'll confirm the lens power again. And she'll give me the lens and say, here's the lens, power's 18.5, and we'll confirm it yet again. So everything is on the same page. We're all doing this together. And you can see the actual cataract surgery time here. The cut time in real time is less than 5 minutes. Maybe I think it's about 4.5 minutes. Again, not really looking at that, not trying to rush. In this entire video, no one is rushing at all. We're all just enjoying taking our time. We're in the zone, right? that state of flow. We have a video about that. If you haven't seen that, go to CataractCoach.com and look up the state of flow. That's like a mental state that's been described where things just happen very efficiently and you're just in this zone, let's say. And so she keeps handing me the next thing. Everything looks great here. And at some point she'll say, okay, she's going to be ready for the lens. She'll hand me the lens. And she'll get it from the scrub tech. She's going to help fill it with viscoelastic and then hand that to me and we'll be good to go. So looks like already cleaning up the cortex here. Everything looks good. We're switching over now. There it is. That's switching over to the handpiece, the IA handpiece, and cleaning things up. And we're going to get rocking here. So very, very efficient case. So now she's calling for the lens. The lens will be open for her. And then she'll load up the lens for me. She's fantastic. And then even she's cleaning up her instruments. She has a little bit of downtime, just getting set up for the cleanup afterwards. So she won't waste any time. She knows what's coming up next in my surgery. She'll also use the auditory clues here. So here's the scrub tech there, and the green cap's going to open the lens for her. And she's using auditory clues on the machine so she can hear, is my vacuum pitch high? Then I'm probably taking out the cortex. If the pitch drops a little bit, she knows I'm pretty much getting there and almost done. And when the machine stops making noise, she knows, okay, now I'm ready for the cohesive viscoelastic to fill up the capsular bag. And look, she's loading up the lens already. I mean, this is the A team. I am so thankful to work with such incredibly good people. You know, we demand excellence, and boy, everyone's on the same page. They deliver. And so that's the anesthesiologist, making sure he's got his notes going. And again, it's not a tremendous amount of sedation for the patient. Total is 1 to 2 milligrams of Versed per patient. And the eye is just numbed with tetracaine. We put some preservative-free lidocaine inside the eye as well. But that's about it. There's no retrobulbar block. There's no injections. There's no needles in the surgery. You don't need strong anesthetics. So now I've got the lens in the eye, taking out the viscoelastic. We're going to be done with this pretty quickly. And we'll seal up the incisions, check everything. And again, tune in tomorrow, January 2nd. I'm going to show you the full surgical video. It'll be the next video in the series here. This is video 1335. That's going to be 1336. And so finishing this up, I just thought it'd be neat to show you exactly what happens here. And again, this is just by putting my phone up on the wall and just taking a little video of what's exactly happening in the room. And this really is the A-team. So finally finishing up here. And what'll be neat is you'll see how we take the drapes off and we create a kind of a pocket with that and get all the trash in there that's going to be taken out as medical waste. All the sharps, of course, are separated and that'll be put in a separate bin. And we are getting this case done. Meanwhile, the circulating nurse is finishing up the paperwork for the case. At the end of this, I'm going to have my operative report to get done, and that'll be very easy. These are very similar templates every time because we're doing this exact same surgery over and over and over again. And then there you go. I'm pretty happy. Check everything. You can see there's a Wexel coming to check the incisions. So here towards the end of the case, just the last few little steps here. And we're going to get this case turned over very quickly. And so now you can look at that little monitor that she's watching. Even though it's blurred out, you can see that white thing is the big Wexel checking the incision at the end. And then we're going to take the scope away. I give her the handles. I give her the speculum. Oh, the phone fell down. They'll put that back. And then there we go. Scope out of the way. Here come the drapes to being taken off. And throw all the drapes together on this big central drape. And we'll get that all wound up. Taking the tape off the patient's head. And so she's getting all the drapes out of the way. That's all going to be medical waste. There's the plastic drape as well on the tape. I'll take my gown off. We'll get some medication for the eye. We're going to put a little bit of an antibiotic on the eye, and then we'll put a little bit of some other medication, perhaps a steroid, whatever your normal routine is. So she's handing me the meds. We'll put that in the eye for the patient. And look at the left side of the screen, the scrub tech, cleaning everything up, putting the cords away, getting the trash thrown out. Very efficient. Instruments are already being passed on to be sterilized and cleaned again for the next use. And then here you go, putting on a little shield over the eye in this case. And then we'll get the patient out of the room. So everything happens in a very efficient manner. Very, very efficient. And again, I'll be happy to show you this video tomorrow. You can actually watch the surgery itself, and I'll do it as an overlay so you can see this in the background. And so we'll just show the surgery part. So now I've just taken off the rest of those monitors for the patient. We'll get this patient out of the room. And look at the left side of the screen, look at the scrub tech. We're just getting all that stuff that's trash and putting it all together. And now we're going to clean up the room. Now the room will be disinfected. And in the proper manner for best cleanliness and sterility and disinfection. And then there you go. You can show you. Done. I'm showing my watch there that it's 9:30 in the morning, and we already knocked out 10 cases. Thanks for watching these videos. Be sure to check out the website too, CataractCoach.com. You'll get the full text and the graphics and the photos, plus the videos. And if you sign up for a free daily email, we'll send all of that to you in your inbox every day for free. Come on. CataractCoach.com. Check it out.